Sawadika, welcome to Thailand. Today I'm Kusuma Yotha Samut. Lately, I have covered a few health-related topics. And today, Thailand Today will discuss overweight and obesity. We will hear from two experts from Chulalongkorn University about a new technique that helps individuals to lose weight successfully and safely. With me today are Associate Professor Prademchai Kongkham, Chief of Divisions of Hospital and Ambulatory Medicine, Faculty of Medical Science, Chulalongkorn University, and Associate Professor Suthep Udom Sawangsap. He is the Director of Chulalongkorn Bariatric and Metabolic Surgery Center, also from King Chulalongkorn Memorial Hospital, to talk about gastric balloon. Balloon. เป็นเลยค่ะ Okay. Please join me to welcome Associate Professor Suthep Udom Sawangsap. He's the Director of Chulalongkorn Bariatric and Metabolic Surgery Center, King Chulalongkorn Memorial Hospital, right here. Sawadika. Also aware another important person is Associate Professor Prademchai Kongkham. He's the Chief of Divisions of Hospital and Ambulatory Medicine, Faculty of Medical, Chulalongkorn University. Sawadika.
Sawadika.
Walter, welcome, sir, both of you to Thailand today.
Thank you. Thank you.
Well, the topic we will talk today is very special, very hopeful for people, especially women. I don't know. But tell me, sir, let me start off with Thai people. Many foreign people always say, why the Thai girls, Thai ladies or women, I mean, on the road actually, not fat, not, they're not overweight. So what is the rate of the overweight in Thailand?
It is true that in Thailand it seems to be not a problem for obese, but from our study it's shown up that we have number of cases.
Really?
So the percentage of obese people now in Thailand would be about 10 to 12%. So it's not small number.
But
actually in Southeast Asians, we are
number one.
Luckily, not number one. We are number two behind Malaysian people. So we do have a problem with obesity, but maybe those who are in trouble with weight, they may hide some way.
I don't hide, I go out. Well, anyway, so what is different? There's overweight and obesity.
We know that weight more than it should be, that would lead to obesity. Those diseases. Okay. So then, when we talk about weight, we need to categorize this. It's not only weight, we need to, because some people will be very tall and then they may have more weight than those who are tall, not that tall. Okay. So we use the index we call body mass index, which is weight in kilogram by square of the height in meter.
Okay, so square, how do you get it, Doctor?
Yeah, weight in kilogram.
Weight in kilogram.
Yeah,
and by
the
height.
Square, yeah,
the square of the
square
height.
of height in meter.
Oh, okay.
So then we have the number. So everyone should have that number. So if the number is 18.5 to 24.9, that is normal. We congratulate for those who have this number.
Okay.
Then when the BMI is more than that, if it's 25 to 29.9, this is overweight.
Okay.
So after that, it is more than 30, that's obese. So then overweight and obese will be different.
Okay.
The problem behind weight is the fat. So fatty mass in the body would cause a lot of problem. For example, diabetes would come, hypertension, dyslipidemia, and sleep apnea. So many diseases will join into those overweight, obese people.
This is overweighting or obese is what? Can it be by hereditary, like pass on from parents to the child?
So the cause of diseases, cause of obese would be multifactorial.
Okay.
So one of the reasons would be by the genetics,
By genetics,
but
yes.
environment is also a major factors that would cause obese.
Very interesting. So this is well, to lose weight program. Is it something new in Thailand?
I don't think it's new, but most of the people realize that they need to do something to lose weight. But how to lose weight, sometimes it's difficult today. So that would be a basic principle. And then everyone needs to do some exercise, workout every day. You don't need to get yourself into the gym or very fantastic exercise places. Just in your normal life, you can do walk, you can do some activity that may get you out of your chair or your table, and then that would burn out some calorie. But the best thing to do is that you may need to do some regular exercise.
We heard from younger generation of today, there's several ways of reducing medication or vomiting. That's more difficult than what we're going to talk today.
Basic thing is to reduce diet, to have diet control and also the lifestyle modification. That's very important. But from now, what we known from the study was that just only some medication would help. But we know that some medication would be a danger, so just be very careful doing that. Under the recommendation of your doctor would be good, but if not, shouldn't do that. It's very harmful too. So, for example, one medication that would be approved to use is act to your GI tract to stop absorbing the fat. So it means that you stop doing some oily food. Yeah, so that would be the medication. But anyway, the treatment of obesity, we categorize up to the degree of the obese. So we know that this is normal, this is overweight, and very much obese. So for those who are just get into the overweight group, so you can do some diet modification and lifestyle change that would help. But if it's more than that, we have some treatment to help the patient.
Wow, we've been having an advice from a doctor in many ways. But one important thing today is the most important question. What is a gastric balloon we're talking about?
All right. So the gastric balloon is a balloon that we place into the patient's stomach. And this will occupy volume, space in the stomach. We will inflate the balloon with water for about 400 to 500 cc. And this inflated balloon will preoccupy space in the stomach. So when a patient has balloon inside the stomach, so then when they eat, they will feel satiety with a lower amount of food. So by that way, from the data from multi-center study, the conclusion is that this balloon can help people reduce weight about 10% of the actual body weight that they are having.
But doctor, you're putting water and the balloon inside?
Yes.
So it has to be every now and then to take it out?
We can this kind of balloon, actually the balloon technique to reduce the body weight has been well known for several years, maybe 10 years, but the US FDA just approved this balloon for reducing the body weight just last year because the quality of the balloon has been much improved over last few years.
Okay.
And so at this time, this balloon has been approved worldwide to reduce body weight of the patients who need that.
I'm sure there's a question arise on the face of the people in 177 countries. So what kind of balloon, is it a balloon that people playing with the balloon that we do or what?
Actually, this balloon is one of the medical device. So it made from the silicone.
Okay.
And it can stay in our stomach for as long as 1 year. And some kind of the balloon is a balloon that can be reinflated. Like we inflate water in the balloon for 400 cc on the first month.
Okay.
And 6 months later, if patients feel that, the amount of the weight that they reduce is not enough, we can inflate another 400 cc in the balloon. And we hope that inflated balloon will help patients to reduce weight to the level that they are anticipated for.
Doctor,
Yes.
I need you to reveal more than that, because how to get the water into it?
Okay, so pressing the balloon inside the stomach, we use just only the simple upper endoscopy technique. We give the sedation to the patients, and then we push the endoscope through the patient's esophagus, stomach, and a proximal small bowel to make sure that there's no contraindication for balloon placement. And then after that, we take the endoscope out, and we tie the balloon together with the endoscope and re-intubate the endoscope into the stomach again, and we deploy the balloon inside the stomach. And after that, we fill balloon with the water.
Okay.
Yes, and that's all. It takes
Sounds
just
like-
about 20 or 30 minutes for the whole procedure, and patients will sleep all time, so they feel no pain, not at all during the procedure.
This is to be considered as a major operation?
No, I think
I
that it's
thought
just
it's a
an
minor.
endoscopy procedure, and the level of the sedation that we need is just the same level that we use for the upper endoscopy to check the stomach. That's the same level.
So, doctor, on what ground will doctor recommend this gastric balloon to implant to the patient?
You mean what's the indication for
Yes,
this?
yes.
Okay, so
What's-
in patients who have body weight and their body mass index are between 25 and 32, and they have some medical illness coming from their obesity. So those patients, actually, firstly, they should try to use a diet control and exercise to control their body weight. But if they can, and they need some help to support, then we are pleased to place intragastric balloon to help them to eat lower volume of the food that they eat. However, if their BMI is so high, as I told you, higher than 32, I mean the success rate of the balloon is quite low.
You may have a lot of patients running from 177 countries, people running out here. So the procedure of doing that.
You mean gastric balloon insertion?
Yes, yes, please. Can you step down a little bit on this?
Okay.
The procedure of doing it.
Yes.
Once man do what?
We have to explain the patient
Yes.
about the risks and benefits of the procedure.
Okay.
The benefits, of course, to reduce body weight, but also the procedure has some complication. The two most common complications of the balloon insertion. The first one is ulcer in the stomach, which occur in about 1/3 of the patient who balloon were placed.
Okay.
And but this can be prevented by patients who will take a peptic ulcer prevention medication during the time that they have the balloon inside the stomach. And the second most common is nausea and vomiting, which occur in about 1/3 of the patient. But this will occur mostly in the first few days or weeks, and this can be treated by anti-vomiting medication. And the next one is abdominal pain or discomfort, which occurs in about 10% of patients. And other complications including perforation of the GI tract, the balloon rupture, and impact or block in the small bowel or infection. This can occur in less than 1% of the patient. That's the bad side or the complication of the gastric balloon insertion. And also, there are several contraindications that we cannot press the balloon to the patient. Yeah, that's several ones that I need to see and read it.
Yes,
Okay,
yes,
all right, okay.
Yes.
The first one is a pregnancy. The second one is inflammatory bowel disease. Or the, and the next one is coagulopathy. I mean, there's some blood coagulation problem. Clot problem, something. Or some abnormal anatomy of the gastrointestinal tract, and then the psychiatric disease, or the drug addict, or the patients have a medical disease who is contraindicated for the endoscopy procedure, or the patients who have the abnormal movement of the GI tract, and the patients who are using the medication that can induce ulcer in the stomach, and patients who cannot follow up with the doctors during the time frame of the balloon insertion, during the next 6 or 12 months that balloon inside the stomach. And the next one is patients who have hernia or have previous operation of the intestine or the stomach. We cannot press the balloon. And the last one, the patients who are allergic to silicone. So those patients, balloon cannot be used for those patients.
Is there any age limitation?
Actually, at this time, generally, I prefer to press the balloon in adult patient, 18 years older.
70?
Let's see the health status of the patient.
Really? Yeah. That can be done, but if you after you
have to
checking
discuss. Have to discuss one by one. Yes.
Interesting. So this is supposed to be a precaution. There's no risk. But you were mentioning that, but it's okay. It can be done. It has to be.
It's a big precaution. Yes.
For that matter. So in your experience so far, more of some of your patients must be from foreign country. Are they? Is there any from foreign country to come?
In our clinic in King Chulalongkorn Memorial Hospital, mostly will be Thai people.
Oh, wow.
But anyway, we also taking care of foreigner. In Chulalongkorn, right now we added balloon in our practice. And also we have done more than 10 years for surgery for obesity. So our clinic has been established for more than 10 years, and we have more than 500 cases in our practice.
So they're happy now. How are they when they come back to you with what kind of expression?
That is very, very impressive. I mean, when they come back, especially
Shapely now.
Mostly from their chef, and importantly from their diseases that they've been out of medication for most of the diseases. So then we talk about balloon. After balloon will be the operation. So that's when we are taking care. So the same principle, how to reduce the satiety or to make people feel full earlier. So we need to reduce the size of the stomach. So by the laparoscopic technique, minimally invasive, we put the scope, we put the port in, and then we can remove part of the stomach. The same principle.
I think this is better.
It is, but
it is?
You know, you do more invasive, you may risk more, and this is permanent thing. When you remove your stomach, we cannot take it back again. So then it's very important for the patient to come and learn, not only from us, they need to learn from those who have done already the procedure, how they have to do after the operation, so the process of the treatment. So right now we have about 30 to 40 patients a day. They come in and then they talk, they discuss. We give them information. All information will be given to them, and then they discuss in the group. Finally, we make a conclusion for them, tailor the technique to them, and then try to have them the best for the treatment. So I think if the BMI is more than 32.5, this group will be very beneficial from the operation. The risk of the operation is less than the benefit that the patient would have. So then if they are 25 to 32.5, maybe the balloon would be suitable for them. For those who are just overweight, so BMI about 25 to 30, I think they can try with themselves with the basic principle of reducing the diet and modify their lifestyle that would help.
Okay, I have to ask for the rest of them who interested in this is how long it takes to recover after this procedure.
Okay, so in general, some patients can go back home in the same day
Right
after
then.
procedure, yes, for the balloon insertion. But some patients may require one night stay in the hospital to give anti-vomiting and or the anti-abdominal pain or make a close observation. So it depends. But in general, not more than one night in the hospital.
So if once that balloon is inside, they do the exercising, everything
Of course,
is normal life.
They can travel by airplane, everything. They can play sport. One of the sport that we just would like to remind is boxing, because the boxing can
somebody
directly injure to the balloon. Otherwise, it should be fine. Golfing, basketball, or whatever they can play. Yeah.
So we are here to talk about this important topic and also very helpful to people. So this 10 years, there's been plenty of patients. I don't want to call patients, but the people who are interested to have it done. So you already suggested this. Any other way that, okay, I would like to have a minute for you, doctor, to talk to the audience, to confirm to them, to tell them that, well, nothing to be afraid of. Go ahead for those who really want to have a better life.
Thank you. Basically, for everyone, we need to take care of our self. Our health is very important. So start today by be conscious with what you are going to eat, and also trying to exercise as much as you can in your daily life. But for those who are already obese, you can calculate by your body mass index. If it's more than 25, but it's still under 32.5, the two basic principles would help you. If not, you can come to our clinic and discuss with our team. The balloon may be good for you. Finally, if you are obese, BMI more than 32.5, and you are in trouble with diseases, we are ready to help you through the process. Just come to our clinic. We have a clinic on Monday at King Chulalongkorn Memorial Hospital. So then we have a group of the patient. We have specialists to assist you, to give you information, to help you through the process of losing weight and to be better in your health. Thank you.
How about you, Dr. Padamchai?
Of course.
Half a minute, please.
Oh, half a minute, okay. So obese is not a good thing. So if possible, don't become obese and try to control yourself. But if you cannot, we are pleased to help you. We are here.
You are in good hand now. So Thailand today would like to thank Associate Professor Prademchai Kongkam and Associate Professor Suthep Udom Swangsap from Chulalongkorn University for keeping abreast of new effective weight loss procedure called gastric balloon. So basically, if you want to remove fat balloon, we need to implant another real balloon to remove the former. Sound pretty interesting, isn't it? Thank you very much for being here.
Thank you. Thank you.
Thank you for watching Thailand today. I'm Kusma Yothasmut. Hope to see you again next time. Swadika.